Topic is protein binding drug. These are completed. Mechanism of protein binding drug is completed in previous video. Now our topic is binding of drug to blood compartment. Plasma protein drug binding. Following entry of drug into the systemic circulation, the first thing with which it can interact at blood compartment like plasma protein, blood cells and hemoglobin. The main interaction of drug in the blood compartment is with the plasma protein which are present in abundant amount and in large variety. The binding of drug to plasma protein is reversible. The extent or order of binding of drug to various plasma protein is albumin, alpha-1 acid glycoprotein, lipoprotein, globulin. Table is blood protein to drug binding. These are the table. Human serum albumin 65,000 3.5 5.0 of all type, alpha-1 acid glycoprotein, lipoprotein, alpha-1 globulin, alpha-2 globulin, hemoglobin. Okay. Binding of drug to human serum albumin. The human serum albumin HSA have a molecular weight of 65,000, is the most abundant plasma protein, 59% of total plasma and 3.5 to 5.0 gram with large drug binding capacity. The therapeutic dose of the most drug is relatively such smaller and their plasma concentration do not normally reach equimolar concentration with HSA. Human serum albumin. The human serum albumin can bind several compounds having varied structure, both endogenous compounds such as fatty acids, bilirubin and tryptophan, as well as drug to bind HSA. Large variety of drug ranging from weak acid, neutral compound to weak base bind to HSA. 4 different sites on HSA have been defined drug binding. Here show identified of drug binding, figure 4.2. 4.2 is this: warfarin binding site, diazepam binding sites, digitoxin, tamifexin. Okay. Site 1, also called as warfarin and azapropazone binding site. Okay. It is represented as the region to which large number of drugs are bound, that is several NSAID, sulfonamides, phenytoin, sodium valproate and bilirubin. Site 2, site 3 and site 4, and these are very few drug bind to the site 3 and site 4. Okay. Binding of drug to lipoprotein. Binding of drug to globulin. Okay. Next is a drug that bind to lipoprotein. These are the topic. Next is this. Our next topic is binding of drug to globulin. These are the topic. Binding of drug to blood cells. Cell membrane.